signs that you should look for. Fever, along with the diarrhea, greater than 101 degrees. Blood or mucus in the stool, that's a sign of actual dysentery. And this is something that actually was caused deaths of more Civil War soldiers than bullets or shrapnel. Black or gray-white stool, you'll find this in people that have liver dysfunction or who have blood in their stool. Abdominal distension and pain, you'll see this in some people that have appendicitis, but they may also have diarrhea. Of course, severe vomiting or diarrhea lasting more than 3 days, because if they have a lot of water coming out from one end, a lot of water coming out from the other end, they are going to develop dehydration. And dehydration from dysentery, from diarrheal disease, is what eventually causes death. You have a certain amount of water content in your body, and when you lose a percentage of that water content, then your body responds. If you lose 1% of the water content in your body activates its thirst mechanism, and you feel thirsty. You drink water and you manage to fill up your tank, so to speak. However, if you are having severe diarrhea and you're having vomiting, you're unable to keep that water content up, you can start getting worse. You lose 2% of your total body water content, you begin to experience anxiety, you lose your appetite, and you begin to experience decreased work efficiency. You're having trouble concentrating. You get to 4% water loss, then you are dizzy, you're fatigued, you develop mood swings, and you may actually start not having nausea and vomiting when you were not having it before. If you hit 6% water loss, you are in big trouble. You have developed, it doesn't sound like much, 6%, but you are in delirium, you have lost coordination, you are beginning to get to the point that you are unable to help yourself. Once you hit 10 to 20%, 10 to 20% of water loss, then you begin to have organ malfunctions, you fail to regulate your own body temperature, and this leads to coma and eventually death, if not corrected. So therefore, it's going to be very important for you to know how to treat dehydration due to diarrheal disease. And the first thing that you need to do, and the basis of it, is to always try to get clear liquids into your patient, if at all possible. And when I say clear liquids, I'm talking about things like chicken broth, Gatorade, Pedialyte is a common thing that's used for kids, or you can actually make your homemade solution, which I'm going to tell you how to make in a minute. Once people are able to manage to keep down clear liquids, you can do a common pediatric diet that's called the BRAT diet. The BRAT diet is something that's a diet that's bland, that is easily tolerated, and it also slows down intestinal motility, so it slows things passing through you. And the BRAT diet is bananas, rice, applesauce, and toast. Dry toast, no, not butter. And so this is an excellent next step after you have proven that your people can keep down clearly. Of course, there are medications like Pepto-Bismol and Imodium that are going to be very useful, and I recommend that you stockpile these as much as you possibly can. This is a prescription drug that's very popular for and very effective for nausea and vomiting. It's called Zofran, and anybody who travels to another country or who is going on an ocean voyage oftentimes asks your doctor for a prescription for this. I've never actually seen the doctor refuse to give it. Ibuprofen and Tylenol are very useful to keep temperature down. However, antibiotics should be used only as a last resort. And the reason why antibiotics should be used only as a last resort is, number one, many times diarrhea is viral in nature, but mostly because the most common side effect of antibiotics in this case is diarrhea.
You're killing the flora.
This is how you can make some homemade oral rehydration solution. Of course, you can buy the stuff here in commercially prepared form. But if you take 6 to 8 teaspoons of sugar per liter of water, 1 teaspoon of salt, regular salt, per liter of water, and a quarter of a teaspoon to half a teaspoon of salt substitute, spelled wrong, sorry. Salt substitute, which is potassium chloride, to get some potassium in the water, and a quarter teaspoon of baking soda to get some bicarbonate in the water, you actually make a pretty reasonable oral rehydration solution. So it doesn't take much, it doesn't take anything that's really hard to find to be able to put together gallons and gallons of your own rehydration solution if you actually needed to.
Hold on, don't flip.
Oh, hold on. Okay. We'll back it up. It's in our book. It's somewhere on our website. Although I can't tell you exactly where, but I've mentioned it. I mentioned a number of times. All right. But yeah, okay. So let's go over again. 6 to 8 teaspoons of sugar per liter, 1 teaspoon of salt per liter, a quarter to half a teaspoon of salt substitute for the potassium, and a quarter teaspoon of baking soda for some bicarbonate. So this is very, I forgot to mention.
If you double the water, 2 liters, that's Pedialyte for your babies. Okay? Same recipe, double the water.
Okay. All right. Now for, okay, no, not yet. Yes. Speak a little bit more. Oh, just go to the, if you want to start stocking up on that, go to your grocery store and just look for salt substitute. The salt, it's the salt that people with high blood pressure can use. Because it's not sodium chloride, it's potassium chloride. And that's what you want. You want the potassium. Anything that's fluoride in it is actually
I think I have some bags of it at home.
So if I had gold and fluoride together, I'd have a gold salt.
I have to filter the water
So it is a salt, but
purify.
it's not sodium.
I think I'm gonna check and see if that's. I'm gonna see if it's what I have at home.
Okay. And now for something you'll really enjoy.
This is not the kind of video you want to look at because I'm waving it all over. Just gonna have to listen.
I got my license. All right, so what is influenza? It is a viral infection of the respiratory tract versus the bacteria. Most of our respiratory infections are viral, which means your antibiotics that the doctor gives you, your child, your baby, ain't gonna work, okay? Viruses cannot be killed by antibiotics. That's it. It usually has severe symptoms. It's a sudden onset. Somebody who gets sick over a period of like 2, 3, 4 days, that is not the flu. The flu starts in the morning, you don't feel well, you wake up with a headache. By mid-afternoon, you can't get out of bed. By the night, you got a fever and you can't even walk to the bathroom. Your body hurts, you're achy, it gets bad quickly. It is highly contagious. If we do have a pandemic, you're gonna need to protect yourself because those viral droplets that are flying out of everybody who's sick, sitting next to you, you're gonna breathe. Highly contagious, so you have to be careful. It is spread by the coughing, sneezing, and contacts. Actually, door handles, bathrooms, you have to be careful. If you know something is going around, watch what you're touching. Carry the little antibacterial gel or spray. Make sure you're protecting yourself.
Viral particles can live on contact surfaces for 48 hours. Droplets from sneezing can travel 6 feet.
The most common complication is pneumonia and sometimes a secondary bacterial infections. Once your body gets infected and your immunity is triggered, sometimes it wears out after a period of time because it keeps fighting the battle and it keeps sending in the soldiers and the soldiers get worn out. And then you end up with a secondary infection. So you have to be careful the people who are sick that not only are you protecting yourself from getting what they have, but you don't give them something else, which makes it worse. Okay, so we talked about some of the symptoms. We talked about the headache. The fever is, again, usually high. If somebody's got 100, 101, it's probably not the flu. We're talking much higher. Again, extreme tiredness. Your body hurts. Your joints hurt. You don't want to even lift your head off the pillow. When you do, it hurts. Your body just ache. Again, the joint aching. You may or may not have vomiting. Not everyone who gets the flu vomits. So it's not, okay, you're vomiting, so then you have the flu, but you're not vomiting, you don't have the flu. You can still have it. Usually it does get into the lungs, and you do have some coughing. And most people with the flu do have a stuffy or runny nose. Most people with the flu have the sore throat. And again, the aches and pains that are involved in those things, those areas. Okay, so how do you protect yourself? How do you protect the sick person? You need to build a sick room if you know that somebody has the flu. And what you need to do is, knowing that those sneezes travel 6 feet, if you're in an open area, you need to at least segregate that person and put as many physical barriers between them and everyone else who's healthy. You need to provide a room if you're in a home, and that room is going to be just for the sick person. You're going to put all your supplies within that room, and you're going to try to limit the number of caregivers, because you don't want too many people traveling in and out. It's just more risk of exposure. So, have the physical barrier, at least 6 feet. Use disinfectants to clean surfaces. We talked about the virus living on surfaces. Make sure you have some bleach, some antiseptics. Make sure you can clean surfaces. It's very important. Frequent hand washes and sanitizers. Whenever you walk into that room, you're going to need to make sure that before you go in, you clean your hands so you're not bringing anything to them. And when you're leaving, you're cleaning yourself so you're not bringing that into the healthy area. Again, gloves are good protection. Now, the 2 masks that you can have, there's surgical masks, which are very cheap. Those are the ones you're going to put on the sick person, because when they sneeze, the surgical mask will hold that in. The respiratory or N95s are what you put on the healthy person. Those have a filter. So if some of the viral droplets escape from the sick person, it's filtered so that that healthy person is not breathing it in. So it protects the medic. Make sure you have careful disposal of the waste, and keep the room ventilated. Don't lock it up. Don't keep the windows shut. Make sure they get some fresh air, okay? And remember, the patient is highly contagious the first 3 days. All right, treatment. We talked about stockpiling antivirals. You can use Tamiflu, Relenza. I'm not too keen on that. It's a powder that's inhaled. I'm not crazy about it. If you're going to stock some, try to use the Tamiflu. Now, if you're... There's what?
My sister is on.
Oh, yeah. Definitely look up herbal. We're going to mention some of that, but not that one. The Tamiflu needs to be used within 48 hours. Once you have that patient that you've seen has gotten sick very quickly, make sure you, if you're going to use it, get the Tamiflu into them. What it does is it decreases their severity of symptoms. Okay, it doesn't necessarily cure them immediately, but they won't get as sick. Now, if you are the medic, what you can do to prevent yourself from getting this flu, if you know this is a very serious flu. I mean, if it's just the run-of-the-mill, you probably don't need to do this. But if we have a serious pandemic, you can take the Tamiflu as the caregiver once a day. There's 10 pills in the container, so you have 10 days of coverage. It should prevent you from getting sick. So it's actually a prevention, okay? So the sick person would take it twice a day, 5 days. The healthy caregiver, once a day, 10 days protection. Okay, some herbal remedies for the treatment of influenza. Tamiflu is only prescription.
So how do you get it?
Yeah, it's got a line about. Yeah, I know what you're talking about.
I will say that.
I don't know if that works. Great, okay. Love natural stuff. Anything that builds your immunity is wonderful.
You ask your doctor for a prescription for Tamiflu during flu season, I doubt very much it will be refused.
Yeah.
Ask for a prescription for everyone in your family, for all your family.
Okay, so some herbal remedies for the treatment of flu if you have somebody who is sick. And these mostly build up your immunity. Your body needs to send out those soldiers. These things can help your body stimulate those soldiers and put more of them out. So echinacea, elderberry is also called sambuco. Garlic is wonderful. Garlic is actually one of the only herbs that has been proven to be antiviral. So it's good. Fresh, crushed garlic. Half a clove on a teaspoon of raw honey. Eat it. Then drink some good tea. Wash it down, okay? Fresh
I like
garlic.
it that way. I don't mind it.
3 times a day. Yeah. Yeah, it is. Also, Asian ginseng is known to help. Wild indigo. Of course, we talked about raw honey, not the store-bought honey, because I've seen research and they don't even know if it's really honey. So get local raw honey. Good stuff. It's also great for wounds. When we talk about burns tomorrow, my 3rd-degree burn treatment, raw honey, and licorice root. And this is just a short list. I mean, we could go on and on and on and on, but just a few.
They smell really good.
Okay, symptomatic relief. You can use Tylenol or Advil for the fever and muscle aches. Some herbal fever reductions are known to be good, are willow bark and elderflower. Fluids, of course, for hydration. If you're thinking about the diarrhea and the vomiting that Dr. Mose was talking about, same thing. The brat diet is good. Lozenges, gargles for sore throat, and herbal teas with lemon and honey. And use the echinacea, the elderberry. Use these good immune-building teas, and add some raw honey, and you have a good cure there. You can also take Sudafed or Afrin for nasal congestion. Some herbal alternatives are cayenne pepper, ginger, onion, and eucalyptus. You can use the eucalyptus either as an essential oil, put it in some steamy water, and put a towel over your head. It's really good. Also, you can use it as a Vicks Vapor Rub. I don't know if any of your mothers did that too. My mom, I smelled like Vicks Vapor Rub half of my life, but eucalyptus is a natural alternative to Vicks. Okay. You can also use, how do you say that again? Guaifenesin. I got it. Or, again, we talked about the steam for the congestion. And some herbal alternatives for chest congestion are tea tree, licorice root, and peppermint. Again, you can use this with the steam.
Mucinex, basically, it's generic.
And
Oh man, me again.
$3, $4.
All
The
right.
dosage is a little bit lower than the steroids.
Well, it's important. It's of course important to know how to deal with environmentally related medical issues, and hyperthermia is a very important one because in many cases it's preventable. Many people, being the rugged individualists that they are, may wind up doing a lot of excessive work in very hot climates, especially if they're in a grid down, power down situation, and may find themselves getting in trouble with heat exhaustion and heat stroke. And simply, this is preventable if you schedule no midday work sessions, if you provide lots of fluids, and when possible, provide a canopy. They're actually, you can get these canopies relatively inexpensively. If you can provide a canopy that people can work under when they're outside, then that is very useful. Now, hyperthermia is referred to as heat exhaustion when it's mild to moderate, and it's referred to as heat stroke when it's severe. And symptoms of heat exhaustion include muscle spasms, fainting, then confusion, followed by rapid pulse, headache, nausea, and vomiting. And the most important thing is an actual increase in the body core temperature to about 105 degrees. Muscle spasms and even feeling faint in hot weather is not necessarily a sign of heat exhaustion, but if you have these symptoms with a core body temperature of 105 degrees, then indeed it does meet the criteria for the diagnosis. Now, in addition to all of these symptoms, if you develop heat stroke, not only do you have these symptoms, but you also lose consciousness, you may have seizures, go into shock, you will become dehydrated, and normally you will lose the ability to sweat. You will lose the ability to regulate your body temperature, and as a result, your temperature can go up to 115 degrees. Some people with heat stroke actually feel vaguely cold and clammy if they're in shock, because the skin becomes sort of cold and clammy. However, taking a temperature will reveal the truth. Now, if you're dealing with heat stroke, of course, the first thing you want to do is you want to eliminate the exposure to whatever the heat source is. So get them out of the sun if you find that they collapse in the sun. You want to remove their clothing, as much clothing as possible, so that they can begin to dissipate some of that heat. You want to position the patient lying down with the feet elevated. This will allow better circulation, and the circulation allows more evaporation. You drench the patient in cool water if at all possible. You want to apply cold compresses, and it's actually better to apply cold compresses in areas where the main arteries pass close to the skin. That would be in the neck area, that would be under the armpit, that would be in the groin area. These are the areas, if you only had the ability to make small numbers of cold compresses, you would limited amount of ice, a limited amount of cold water, you would put them in those areas. It would more effectively transport the cooling temperatures to the body core, and that's what you need to do. If you have the ability to fan the patient, either manually or if you have a fan, that would be good. It also helps that. If the patient is awake, you want to give them fluids. If the patient is groggy, not awake, completely awake and alert, they may wind up aspirating some of that fluid into their lungs, so you don't want to do this unless your patient is awake and alert enough to take the fluids. And how about Advil or Tylenol to lower the temperature? Well, interestingly enough, Advil and Tylenol often don't work in these kind of cases because they're meant to lower temperatures in the case of infection. And they don't work as well if there is no infection.
Oh, so you don't just, I wouldn't have thought so, but.
Now, hypothermia is another thing that you'll have to deal with. And this most often is caused by immersion in water, because the more of your body surface that is exposed to the cold, the more likely your body core temperature will drop down. And if your body core temperature is less than about 95 degrees, you begin to experience some ill effects. Now, exposure to wind is also very important. Now, the wind chill factor, let's say it's 30 degrees out, but the wind chill factor is 5 degrees, you lose heat from your body as if it were 5 degrees. So that's an important thing to know, that you want to prevent exposure to wind if at all possible, especially if there's a risk of hypothermia. People that are very young or very old are much more likely to become hypothermic. People with some chronic medical conditions such as diabetics are commonly victims of hypothermia. Now, interestingly, people who are alcoholics, people who have a large amount of alcohol in their bloodstream, isn't it funny how when you drink some alcohol, you feel a little warm? But the truth of the matter is, so therefore you would think that it would be good for hypothermia, but it actually isn't, because it expands the blood vessels, and that causes more dissipation of heat from your body. And so, using alcohol, if you see a Saint Bernard with a cask of brandy around its neck, finding people lost in the Alps, that actually would be a bad thing to do, because you don't want anybody to have alcohol in their system if you want them to get better from hypothermia. Now, once your body temperature goes below 95 degrees, your first thing that you're going to do is you're going to start shivering. In and of itself, this is just a way that your body is trying to produce heat. But once you are in this situation and you are not getting out of this situation, then you begin to have other problems, and they mostly involve your mental status. And the reason why that is because the lower that the temperature of your brain is, the blood flowing through your brain is, the slower your brain actually works. And so you're going to wind up having decreased mental status, confusion, lethargy, slurred speech, loss of coordination. You have people uninterested in helping themselves, and loss of consciousness eventually, and over time, organ failure. Now, if you are in cold weather and you come across somebody that is unconscious, that person is hypothermic until you have proven otherwise by taking their temperature and seeing that they're not. So this is one thing that you have to know. Don't wait, start treating them for hypothermia. Other cold-related injuries include frostbite. In frostbite, you wind up having, the frostbite affects usually extremities, like fingers and toes, nose, earlobes, things like that. And what happens is that when exposed to cold, excessive cold, they'll start changing color. They'll go blue, then white, then red, and eventually, if it's bad enough, it goes to black. And once it's black, then that means that tissue has died, and you indeed will find that parts of fingers and things like either have to be amputated, or interestingly enough, fall off by themselves. Okay. Also, there's something called immersion foot. In World War I, this was referred to as trench foot. And this is basically what happens when you spend a lot of time with your feet in cold water. And it's basically very similar to frostbite, except that there's more generalized swelling involved, which you don't see much here, but you see quite a bit here. But the end result is, again, gangrene, this blackened area, which is tissue that has died, and that's what happens. Now, to treat hypothermia, of course, just like hyperthermia, you move the person out of the offending stimulus, which in this case is cold. Okay, you want to remove any clothing that's wet, especially if you've gotten somebody out of the water, and you want to cover them as much as possible with blankets everywhere except for their face. You want to cover their head because there's a significant body surface, and you will help warm them up by covering their head. You have to, if you see that they're unconscious, you have to monitor their vital signs. They have make sure they have a pulse and that they are indeed breathing. Now, sometimes it's useful to actually take off some of your clothes and actually cuddle with them. Now, you may not be the cuddly type, but you actually will be able to share body heat with them, and you would do them a great deal of good if you could do it. Woohoo!
No babies.
And if cautious, if they're able to, if they're awake and alert, give them some warm beverages. Now, things that you do want to avoid, of course, you want to avoid giving them any alcohol, because as we mentioned, that it actually does the opposite of warming you up. You want to, I think I mentioned that, wrap in warm blankets. And this time you want to place warm, dry compresses. You don't want your patient to be wet, but in the same places, because now you want to transfer warmth to the other parts of their body. And so you would use warm, dry compresses to the neck, groin, armpit area. However, you want to avoid directly applying a hot water bottle, heating pads, or heating lamps to the patient, because that skin, if that person has been out long enough, the skin has been compromised, and you will traumatize the patient more by using that. Now, you're not supposed to rub tissue that is frostbitten in the hands or the legs, things like that. However, you can give a warm massage to the torso of somebody that is generally hypothermic, but it's not good in frostbitten tissue. And also, unlike general hypothermia where you want warm, dry compresses, for frostbite and immersion foot, you could give them warm soaks, but the temperature of the water should be less than 104 degrees.
damages this game.
This concludes part one of our talk. It's been about an hour, and you have been very patient to go through it, more than an hour. And if you're unable to make part two, which will be burns, fractures, major trauma, tomorrow at noon, you can, of course, obtain our CD, which is basically a combination of both of the classes in one.